The government has moved Ireland to full level 5 restrictions in a bid to tackle the latest spike in COVID cases. Excuse me. There'll be a ban on household visits while non-essential retail will close. It comes as the Department of Health confirmed another 1,718 new cases and 13 deaths, while there were 455 people in hospital with the virus, 37 of those in intensive care. For more on that, we're joined by Dr. Tony Holohan, Chief Medical Officer at the Department of Health. Good morning, Dr. Holohan. Thank you for joining us. Those numbers I've just quoted there are bad enough. Happy New Year to you as well, by the way.
Happy returns.
Those numbers are bad enough, but there's another set of numbers which the HSE issued last night, and they are reporting 100 cases a day with 20 to 30 close contacts. That's potentially 2,000 to 3,000 infections per day. Now, a week of that and our health service is swamped.
We've seen a very significant increase in the number of contacts, as you rightly say, on average per person. And yes, some of those individual contacts or cases rather generating very large numbers of contacts. So clearly there are some people out there who are simply not in any way following the basic public health advice in terms of minimising social contacts. When you have a case and you're able to identify 20 and 30 contacts, this is just a place, as it were, we shouldn't be. But we've seen the average number of contacts per confirmed case increasing. We got down as low as about close to 2.5 in the month of November, I should say, after the measures were introduced in mid to late October, and that has just trended up quite sharply now, particularly in the course of the last couple of weeks. We eased the restrictions at the beginning of December. It increased, and it just continued to increase through, and it was up to an average of 6.3 in recent days.
Okay,
simply way too high.
The operative words in that were people not following your advice. And I think it's pretty fair to say that our previous 6-week lockdown didn't work as hoped. But it also has to be said that it wasn't done the way you wanted it to be done. The government didn't follow your advice to the letter. Now, you're not a man to go, I told you so. But they didn't listen to you back then, and we now are where we are. Are they listening to you now?
Well, look, the basic measures that we put in place as a country and the government approved in October had the objective of protecting public health, first of all, and then protecting the continued delivery of education, of keeping the health services free of COVID so they could look after other health needs, and of providing childcare and protecting people who are vulnerable. And to the extent that we can compare how we've performed as a country with other European countries, it did work. We kept mortality at a very low level in comparison to the European average. If we stayed on the track of the European average when those measures were introduced in October and kept at the European average, we would have seen by the end of November, we might have seen something in the order of about 40 deaths a day, when our average at that point was in the region of about 5. So we know we prevented a very significant wave of mortality, most importantly, hospitalisation and infection, that the rest of Europe simply hasn't been able to prevent. So we know we've had a significant impact. When we got to the end of November, the case numbers that we had were somewhere in the region of about 250 per day on a 5-day average, and that was a high level of infection. In relative terms, when we began to ease restrictions, then we know we've seen a significant change in people's behaviour in terms of social contacts. When you put that together with the high case numbers, we've just seen a very rapid acceleration, particularly over the second half of December in the case numbers, and to a level, as you rightly say, that we simply can't cope with, we can't manage. And the measures that government has now fully mandated as of yesterday, we know they've worked before in this country. They're very hard to have to accept again, both economically and the restrictions in their personal lives and freedoms and all of those things. But we do know that if we keep a very high level of compliance that most of us have followed all the way through this, we know already that this is a measure that can work. It's unfortunate that we have to take it, but we're in the situation now where we need a measure, because this virus it is out of control in the population. We don't have sufficient control.
I know you won't speculate, but the Taoiseach has already said to the end of January and maybe beyond for some of the restrictions. The Taoiseach has been hinting for a while now that this could possibly be 2 months, and we are hearing rumours coming out of government buildings that one senior source said, if we get out of this by Paddy's Day, we'll be doing well.
like there is a lot of infection. I mean, the 5-day average case number at the moment is really it's at a level that we haven't seen before, and the number of infections at the moment we think is going to continue to rise. At the moment, I'm not able to tell you that I see any sign that suggests that this is slowing down, unfortunately.
Okay.
With that very high level of infection, it's going to take quite an amount of time, if I can say, to kind of wash that level of infection out of the population. So we have it all to do in the 4 weeks to the end of January to get ourselves to a situation where we can begin to ease.
Okay, look, I know your words matter and you choose them very carefully, but March might not be out of the question.
Yeah, I can't rule that out. I couldn't rule that out.
Okay,
but like at the moment, we have a 4-week opportunity. Like, if I could put it in very simple terms, Mark, and I know this wouldn't be possible, but if every single person could isolate themselves from every other person in the population for a period of 14 days, the whole infection would disappear. We know that's not possible. We know that there has a certain amount of activity that has to, but to the extent that we can each limit our social contacts, follow the public health advice, we can really make a significant and very rapid impact on this. But if we have a half-hearted implementation of it, it is going to continue for a long period of time. So the government has done its part now. It's now to each one of your listeners, each one of us as individuals, to ask ourselves, are we doing everything we can